Now that we want to help you gear up for flu season. I get it, it's still summer, but it's time to talk about it and get one step ahead of it. So Dr. Jack Ross is the chief of infectious disease at Hartford Hospital. He's joining me now to answer some of your questions. Good morning to you, and thank you for coming in.
Thank you very much for the opportunity.
Well, I know a lot of people are thinking, okay, we just had Labor Day, why are we taking flu season? But this is really something that is kind of the next thing that we're going to be dealing with. Happens every single year, and the vaccine's already available to many people, isn't it?
That's correct. What we're seeing today is in the large retail chains, be it CVS, Walgreens, Rite Aid, they have vaccines sometimes as early as the 1st of July. All the chains now have it, and they've started to administer it to those who wish to get a flu shot.
So some of the headlines that we're dealing with right now is, okay, so the flu mist, not worth getting because, and not even going to be available because it wasn't really working. And then if people hear other numbers like, well, only 63% of the time does the actual, shot work, they might think, well, what's the point? But there really is a point in getting this shot, isn't there?
It's a great question. There is definitely an issue. This is one of those public health things where you can protect large numbers of people, like hand hygiene, like a safe water or food supply. By vaccinating the children, where it's over 80% effective, it protects those, perhaps like myself, over 60, the grandparents, the great-grandparents, from getting influenza. In that age group, it's a much more serious disease. So it's a concept of herd immunity. Let's go after potentially the little vectors, the children. Let's protect everybody.
And even if they do end up getting it, because it's not 100%, it's going to be a kinder, gentler flu, isn't it?
It actually may attenuate the symptoms that you have.
Are we good in terms of supply? Are we going to see a shortage, do you think?
I think this is one of the earliest years that I've seen our hospital and Hartford healthcare facilities receive vaccine. We've been notified of no shortages, so there should be more than enough. In general, about 170 million doses are produced for the entire country. And usually at the end of the season, some of that is left. Only about half of us get our flu shots.
Yeah, we got to get those flu shots. And here's a good way to remember it. It's an election year. Yeah. And you say, so maybe they should go vote and go get a flu shot at the same time.
CDC says do it by the end of October or when available. I say let's just get it done by Election Day.
Okay, so you've got some time. And just a word to the wise then, for people who are like, yeah, this is the last thing I have time to do. It should be somewhere on that to-do list.
It should be. Definitely should be.
All right, thanks so much for coming.
You're
Hopefully
welcome.
we have a mild season, but we'll wait and see.
We'll know.
We will, and I'm sure we'll be talking. Okay.